Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weisheit, licensed clinical social worker. Thank you so much for joining us, however you may be joining us. And as you can see, joining me, Earl Eues, Director of Emergency Preparedness for the Department of Homeland Security for Terrebonne Parish. Earl, welcome to the program.
Hey, Keith, thanks for having me.
We appreciate it. Look, I know it's one of those things that it just seems to be getting worse and worse. And then people just don't want to make any changes. It seems like we're having some real significant increases with our positivity rates.
Yeah, I mean, today the LDH released the positivity rate for Terrebonne, or for the whole state, but for Terrebonne Parish, it's now at 18.8%, up from 14.6% from last week. So, it's not getting any better here.
You know, it's interesting. We were talking for a long time about staying below that 5% threshold, right? And that was one of the ways that we knew we were doing a good job mitigating at 5%. We're up 4%. And I'm just thinking there was a time when 5%, below 5% was so very important. Being up 4% is a significant increase. And here at almost 19%, that's 1/5.
Well, if people don't understand what that means, let's just round that up to 19. So for every 100 people that go get tested, 19 of those are positive. Okay, so that's only the people that's going to get tested.
Yeah,
and we're hearing numbers that are higher than that at certain areas, certain different testing sites, where the positivity rates are up in the 20%.
And we're talking 1 out of every 5 people that are getting tested. And that's not to count all the people that have come into contact with others who have stayed at home. I mean, I've got 4 people today, Earl, 4 people today of the 10 clinics that I've called on, or the 8 clinics and 2 hospitals and the 2 places that I visited. There are 4 people that are not there because they've either got COVID or they're a close contact with somebody who has.
Yeah, well, people are wondering if the governor is going to have to do is going to do a shutdown. I don't think he's going to do that, because the virus is going to do it itself. And we're seeing that right now in our community, where restaurants and other businesses are having to close because they don't have any employees to work because they're home sick.
Yeah, and so the employees being homesick is affecting the community and the ability for people to make a living. And that's not even to mention the number of people that are, and Oshner has reported out some of the people that they have. They've got a significant number of people that are not able to go to work to care for a lot of these hospitalized COVID patients. And again, I think we're still seeing about the same number or percentage of those people in the hospital settings that are far less, considerably less. I've heard 2%. Only 2% of the people in one particular facility is those people that have been vaccinated versus unvaccinated.
Right. So in that one facility, you're looking at 98% of the people who are unvaccinated that are in there. I think that the statewide percentage right now is somewhere between 89 and 90% of the people in the hospital are unvaccinated.
Yeah, and so 9 out of 10. And so, and I know we're going to spend a little time later talking about vaccinations and what people can do and how it's frustrating for those of us that have seen the differences that the vaccinations have made versus some of the paranoia that people have about what the vaccinations may or may not do. But we're seeing a significant rise. We've got people, our hospitals diverting. There are emergency rooms that are holding people in beds in an emergency room waiting for a bed upstairs.
Yeah, and I don't know if the community realizes, the importance of wearing the mask. A lot of people say, well, I'm vaccinated, why do I have to wear the mask? Well, it has been shown that even though you're vaccinated, you can be a carrier of the virus. So what we're asking you to do is please wear your mask so you don't spread it to other people. And if you're one of those that say, well, I don't need to wear a mask because I'm not worried if I get sick or if I get the virus. Well, I understand your point. But the other point to that is that you're spreading it to other people by not wearing a mask. We've seen the mask mandate work. So let's all pitch in go get vaccinated, wear a mask at least for the next month or so we can get over this surge, and try to get as many people vaccinated as possible. If we don't do the vaccinations, we're going to continue to have these variants pop up, and we just don't know what the next variant's going to be like.
Well, and what we do know here is we got about 30 seconds left here in this segment. We do know that this variant has been the worst one. It's spread more quickly. It's been a little bit more potent. That's what we're dealing with, right?
Yeah. Well, I mean, right now, today, I think we got about 122 people in the hospital with COVID, and within Terrebonne and Lafourche Parish, both parishes. 17 people on a vent. Okay. These numbers haven't been this high that I can remember from the start of from when we started this in March of 2020. So, people need to realize that this Delta variant is a lot more contagious, and it carries a very large viral load, up to 1,000 times more viral load than what we were dealing with when the COVID first came out. So we need to wear our masks. We need to practice social distancing. We need to, continue our hand washing and do what we need to do so we can prevent the spread of this variant.
Earl, we always appreciate your time. We look forward to talking to you again real soon. Thanks so much.
Thank you.
All right. And again, that's Earl Eues, who is Director of Emergency Preparedness here for Terrebonne Parish. All right, we're going to take a break. When we come back, more local programming. Don't go anywhere.